everybody. It's Friday, and I did go weigh in, and as suspected, I went up um, 3 pounds. In kilos, it's one count, one count, 1 kilo. So I'd rather say it in kilos. I went up 1 kilo instead of 3 pounds, but I'm not sweating it. I know that I'm gonna lose them, and hopefully I'll lose 3 more by next Friday to make 6 pounds. So I'm okay with it. It could have been worse with Christmas and everything. So yeah. Yesterday I mentioned that I was a little bit depressed in a funk, and that's because I talked to the doctor and they're still waiting for the part needed for the respiratory machine they need for me. So that kind of bummed me out because that means he can't give me a date on when I'm going to have surgery. So yeah, I was kind of bummed about that. He also told me that the anesthesiologists want me to start a respiratory therapy. Not because they feel that I have sleep apnea. The doctor told me it's because, I was honest enough to say that I have snoring problems. So they decided that it would be best for me to start the respiratory therapy now, so that by the time I go to surgery, I'll be already used to it. And he also mentioned that after surgery, I'm probably gonna have to keep up the therapy for a while. And he also mentioned that it was so um, when I'm used to it, it will prevent my respiratory um, passageway, whatever you want to call it, from collapsing during surgery. Which, as far as I'm concerned, yeah, I need to prevent that because I don't want that to happen to me. So I had to get the machine because with public insurance, there's only so much that they're willing to pay for. Um, so they don't offer the machine, and as a matter of fact, I think because of the fact that what I mostly have is a snoring issue and not complete sleep apnea, I they didn't even bother sending me for testing. So this is going to be a trial and error um, to find out what air pressure level I'm going to be needing. So I got it today, and let me show it to you. Here it is. There. It's they refer to it as a CPAP, and this is a Brius PV10. That's the model. Here's the hose, the mask, and lovely headgear. I'm going to be putting it on to let you see what it looks like. The lady that came to drop it off, she explained to me how to use it, how to change the pressure levels. But she was kind enough to tell me that if I preferred her to change the levels or anything like that, if I had any questions, that I could just call her and she would come over as soon as she could, which is great because she's always around this area. Since I live pretty close to the hospital, she's always here around the area making deliveries of other medical equipment. So she also told me that as far as how long I'm going to be needing this after surgery, um, she told me that she couldn't tell me that because everyone is different, and that weight has absolutely nothing to do with whether you or not you're suffering from sleep apnea, because she has one person that has done the surgery, has gotten down to less than 230 pounds, and this person is still suffering from sleep apnea. So most of the weight really doesn't have anything to do with it. She just told me everyone is different, and I just have to keep using it until I stop snoring. So yeah, the other thing she told me was that people with sleep apnea have a tougher time during surgery, not only because it makes it more risky, but because it takes longer to get out of anesthesia if you're, especially if you're not used to this type of sleep therapy, um, respiratory therapy, I mean. She told me that there was a patient a few weeks ago that the hospital, was like freaking out because this person was not coming out of anesthesia. This person came out of anesthesia like almost 30 to 45 minutes later than what he was supposed to, and that's because he was suffering from sleep apnea and didn't say anything. So you really need to let your doctors know what's going on with you. You have to be very honest, even if you don't want to be dealing with this kind of equipment, because that is something really scary um, to put on your family and your friends that are probably waiting for you to get out of surgery, and you don't want to do that. Plus, the hospital, and all the doctors and nurses, freaking out because you're not coming out of it, so they're going to think something's really up. So let me put this on so that you can see. This is the lovely headgear. Um, Let me see which way is it. Because again, I just got it today, and I was recommended to take an afternoon nap and start trying this out, so that I would be used to it. Oh, lovely! I look like a wrestler. Lovely. Let me turn this on. It's turned on. See, it's not oxygen, it's just air. I have to keep one of these vents open, and all I do is just clip it on. Turn it off. Um, it does bring a good amount of air into your passageway. So when I open my mouth, the air comes straight out my mouth. It doesn't let me talk. It doesn't let me breathe. So it can actually suffocate me if I have my mouth open. So actually what this does also is force you to sleep with your mouth closed, because if not, then you can't breathe. So that's pretty good, because we're all supposed to, when we sleep with our mouth shut. Um, Another thing that this lady told me is that since more and more kids are sleeping with their mouth open since infancy, that the rate of young people, young adults, actually, um, suffering from sleep apnea and having to use these kinds of devices is going to skyrocket in the next few years. So for those of you that have young kids in your life, teenagers, or anything, you need to start advising everyone to do their best to not sleep in a position where they're going to have their mouth open. Okay, so that's it. That's all I wanted to share with you guys today. I hope everyone has a great weekend, and next week I'm pushing for 6 pounds lost. Okay, bye.